Hi everyone, this is our presentation on Epi Pens, what they are and how to use them. This is presented by Aleida, Evelyn, Itzel, Hannah, and Nancy. So first off, what is an Epi Pen? So an Epi Pen is an auto-injectable device designed to administer the medication epinephrine. Epinephrine acts on the body to block the progression of an allergic response. It constricts the blood vessels, causing high blood pressure and decreases swelling. The muscles relax and the airways open.
Who might need an EpiPen? An EpiPen is a life-saving medication used when someone is experiencing anaphylaxis. What is anaphylaxis, you may ask? Anaphylaxis is a severe, life-threatening allergic reaction that occurs when the body's immune system overreacts to an allergen. An EpiPen is used by those who have allergies that may cause them to be at risk for anaphylaxis. That allergy may be an insect sting or a food. This is why it's important to go to an allergist if you believe you have had an allergic reaction to a food and/or an insect sting. What is an allergic reaction? When you first come across something you're allergic to, your body creates an IgE, which is an immunoglobulin E antibody, which you can think of as little fighters or attackers. These fighters search for the allergen, and when they find it, they send a message to mast cells. Mast cells, which are allergy cells, are like guard stations in your body. Once the fighters, the IgE antibodies, deliver the message to the mast cells, they release a substance called histamine. Histamine is what alerts your body and what causes symptoms such as itching, swelling, and other reactions that happen during an allergy attack.
When to use an EpiPen? It is important to use an EpiPen immediately when you experience allergic reaction symptoms. These symptoms include shortness of breath, weak pulse, generalized hives, tightness in throat, and trouble swallowing. If you know you have a history of severe asthma, use your EpiPen as soon as you believe you have eaten any food that causes allergic reactions. If you are unsure if a situation calls for the use of an EpiPen or not, use it anyway. The benefits of epinephrine outweigh the risks of an unnecessary dose.
How to use an EpiPen in 5 steps. First, take off the blue safety cap. Then, hold EpiPen like a fist with orange part pointing down. Then, press orange tip firmly against the outside portion of your thigh. Then, keep it pressed in the thigh for 3 seconds, and you can count until 3. And lastly, get emergency medical help right away. A very important note that you should be considering is that the needle comes out the orange side. Remember, blue to the sky and orange to the thigh.
Here are some safety tips on how to properly administer an EpiPen. First, remain calm. Intensified panic may lead to increased fear, which can make the symptoms of the allergic reaction worse. The second tip is to be proactive by regularly checking the expiration date. An expired EpiPen is ineffective, meaning it won't relieve the symptoms and won't be useful. The third tip is to read the instructions on how to administer if needed. You can find the instructions on the side of the device. The fourth tip is to always carry an EpiPen with you because you may not know when a severe allergic reaction will happen. Also, it is recommended to carry an extra EpiPen because you might need to administer a second dose in case symptoms worsen or if they persist after 5 minutes following administration. The fifth tip is to keep the EpiPen at room temperature, not too cold and not too hot or humid. Lastly, the liquid medicine contained in the device should be cleared. If the liquid is discolored or has floating specks, do not use. Get a new EpiPen. If it's not available and you are or someone is experiencing a severe allergic reaction, call 911 or have someone call 911 and be ready to perform CPR if respiration stops.
These are our resources and our contributions. Thank you.